We're pleased to have with us today Dr. Stephen Ross. Dr. Ross is a professor of orthopedics here at UC Irvine Medical Center and has been in practice for over 30 years. Dr. Ross's practice is limited to foot and ankle orthopedics with a special interest in ankle arthritis. Dr. Ross has been voted by his peers to be included in the best doctors in America. Welcome, Dr. Ross.
Thank you.
Let's talk a little bit today about arthritis of the foot and ankle. What exactly is arthritis?
Well, of course, arthritis is the inflammatory response in a joint, and there are three basic types of arthritis. Osteoarthritis, or general wear and tear arthritis, which involves degeneration of the articular surfaces of the joint. So the cartilage becomes thin, the body responds by creating an inflammatory response, maybe osteophytes around the joint with limited motion, possible pain, and decrease in level of function. A secondary group would be the post-traumatic arthritis, which of course is very similar to the osteoarthritis, but there's usually a traumatic event, such as a fracture of the ankle or a severe crushing injury to the foot or ankle, creating damage to the cartilage surfaces and that natural progression of loss of cartilage and the inflammatory response that the body brings on. And finally, there's a group of patients with the inflammatory arthritides, such as the rheumatoid arthritis. In those patients, the synovium becomes inflamed due to their systemic disease, and it can involve all of their joints, but special emphasis on the ankle joint because it's so important in the patient's ability to walk and stand.
What are some of the joints that are most commonly affected by arthritis in the foot and ankle?
Well, fortunately, the ankle has many joints, so some of them can be used to accommodate for damage to the others. But there's the ankle joint, which is the major large joint involved up and down motion, the peritalar joints, which do side to side, and then the mid-tarsal joints, which are often involved, as well as the forefoot joints, in the inflammatory arthritides, such as the rheumatoid arthritis.
And what are some symptoms that patients usually complain of with arthritis in the foot and ankle?
Well, it's almost always related to pain. So pain, swelling, limited motion, difficulty with activities of daily living, running and jumping, all of those things that people find important for the activities that they just want to do.
And what is therefore needed to make a diagnosis of arthritis of the foot and ankle?
Well, as in all medical problems, you need a good, thorough history. You have to understand the patient's general medical problems, their general health, along with any major medical issues that they have. And then, of course, a very focused physical examination to the part of the body that's of interest on that particular visit. And of course, in my practice, it's mostly in the foot and ankle. So overall alignment, their gait, the activities they're capable of, can they stand on their toes, how do they function, do the joints have motion, do the joints have stability, do they have a lot of swelling or inflammation, and then of course do they have adequate blood supply and nerve supply to the extremity. So a good history, physical examination, and then of course diagnostic studies such as x-rays, usually in a standing position. We take x-rays to check on the nature of the joints themselves, their overall alignment, any changes that have occurred around these joints due to the arthritis. And there are even some patients that require specialized studies such as computerized axial tomography or CAT scans or MRI studies to help us look at the soft tissues around the joints of the foot and ankle.
And what are some treatment options then, both surgical and non-surgical, for arthritis of the foot and ankle?
So of course arthritis comes in varying degrees, from the very mild to the very severe, depending on how much cartilage has been lost. For the mild ones, and for most patients, there's going to be a trial of conservative treatment. And that's going to involve non-steroidal anti-inflammatory medications, a period of relative rest, maybe immobilization with a cast or a brace, some kind of external support. There are even patients that have severe inflammation in the joint that can be treated with a little cortisone injection to help alleviate the inflammation around the joint. And then for more chronic problems, hyaluronic acid injections can be helpful also in decreasing the inflammation around the joints and making them more functional for a longer period of time. So physical therapy can be beneficial to gain strength in the muscles around any of these arthritic joints, as well as the anti-inflammatory medications.
Great. Thank you, Dr. Ross.